Precision medicine, it's about you. Coming up next on Call the Doctor. You are not alone.
Call the doctor.
Call the doctor.
Call the doctor.
Precision medicine, it's a term you're likely to hear more often as a greater number of healthcare providers adopt more individualized approaches toward keeping people healthy. The National Institutes of Health describes precision medicine as an emerging tactic for disease prevention that takes into account a person's unique genetics, environment, and lifestyle. This approach allows doctors and researchers to more accurately predict which treatment and prevention strategies will work best for specific diseases affecting each individual. The advantage of precision medicine is that it moves beyond the traditional one-size-fits-all approach, in which disease treatment and prevention strategies are developed for the average person, paying less attention to the differences between individuals. Tonight, we'll take a closer look at precision medicine, what it entails, and what it can mean for improving healthcare efficiency and effectiveness throughout our region. Welcome to Call the Doctor here on WVIA TV. I'm Paula Giacomo. Tonight, our topic is precision medicine. Joining us on the panel are Dr. Michael Murray, who is the Director of Clinical Genomics at Geisinger's Genomic Medicine Institute, Marcy Schwartz, a licensed genetic counselor at Geisinger's Genomic Medicine Institute, and Dr. Murugu Manikim, a clinical geneticist from Geisinger Commonwealth School of Medicine in Scranton. I would like to remind the audience that the viewers at home can participate by commenting along with the conversation at wvia.org/CTD. You can also submit your questions for future shows by emailing ctd@wvia.org or using the hashtag WVIACTD. And you can check our website for a listing of future programs. Now, let's begin our discussion. First of all, we heard a little bit in the opening about what is precision medicine, but Dr. Murray, could you expand a little bit about this new approach in the healthcare industry?
Sure. So precision medicine is a relatively new term. It's also been called personalized medicine and some other terms along the way. But I think the basic idea is that we can start to use new tools to understand people's risk and also ways to keep them healthy that we didn't have at our disposal just 5 or 10 years ago. And we're particularly interested in the use of DNA and genetics as a tool to do that.
And this is where Geisinger comes in, because they started this MyCode initiative where people can actually volunteer to get their DNA tested. Can you tell me a little bit about that?
Sure. MyCode Community Health Initiative is a large study that we have going on at Geisinger. Many patients throughout the system have signed up, over 140,000 individuals, and essentially they're consenting to be a part of research and provide a blood or saliva sample for DNA sequencing. They're also allowing Geisinger to use that information along with their electronic health record data, particularly about their medical history without their name attached, for different research purposes. As a part of the MyCode program, in addition to using the information for research, there's also an arm where a subset of individuals will receive back some personalized health information in the form of genetic risk results.
So for example, if I want to know what risk I have for developing cancer, you would take my DNA and test it.
Well, one of the things we're careful to inform people is that right now our knowledge is at a very early stage. So even though we've been studying genetics for years, what we can apply right now is somewhat limited. So we look at 76 genes out of 20,000 genes in a person's genetic code, and we give them back information about any one of those 76 if we find it. So we're careful to tell people that this is not a genetic testing service. There's lots of reasons why people might talk to their healthcare providers and need to get a genetic test for one reason or another. But this is more coming out of the opportunity that they're joining this research project. their DNA code is being looked at, and we might find things in there that they and their doctor ought to know about. So when we find that, that's when we get back in touch with them.
And because this is so revolutionary, it's changing the way genetics is being taught at the medical college. Is that right, doctor?
That's right too. So because we have an opportunity to figure out how this is happening now, and pretty unique to the Geisinger and to the central northeast Pennsylvania area, we can teach the next generation of medical students and nurses and things like that about what to expect when they're in practice in 10, 15 years. We're 10 to 15 years where this is going to become, we think, regular practice, but we're just learning how to do it right now.
Exactly. So is one of the disadvantages that there's not enough medical professionals out there who can read DNA? Is that correct?
So we're all involved in educating other healthcare professionals, and there's a lot to be done. And so, you know, every healthcare professional will need to have a working knowledge of genetics and precision medicine, and then there'll be some experts in it. Just like any area of medicine, everyone needs to know about antibiotics, for instance, but there's antibiotic specialists too. We think that sort of there'll be a range of educational needs for everybody within healthcare.
And it's interesting because this is getting to be so big that they brought you in from out of the area. You're from Harvard, you said, and you've been here
about 4 years, a little bit more.
Okay, and you came from
Ohio State,
Ohio, and you came from
Johns Hopkins.
Okay. So what drew you in? Was it just because it's so fascinating? And
so I always tell the story that right before I left Harvard, we got a big grant to do the genetic code on 100 people in 2012, and we were very excited. And here at Geisinger, we're doing the genetic code on over 100,000 people. So it's really the scale of the project and the opportunity to help people understand what their genetic code means and really learn new things about ways to use this. So it's the only place in the world to do this right now.
And you're looking to test even more people, 250,000, is that right?
That's the goal.
So what are the risks and the benefits to this?
So the
approach?
risks for patients are somewhat minimal for this. It involves consenting, talking to somebody about what actually goes into the study, and mostly we're just looking for information. And then there's a blood draw that goes along with it, or as Marcy mentioned, you could also do it by a spit sample or saliva sample. And then we don't expect that a lot of people are going to necessarily get results, about 3.5% is our current estimate. But all of that information helps us take care of patients better overall.
Mm-hmm. And why would someone want to join this new procedure?
Well, I think the main reason why our Geisinger patients join this is to help out. So like any research project, we approach them and we tell them about MyCode and the fact that we're going to learn new things about health through it, and we invite them to join. And so out of the goodness of their heart, they say if Geisinger thinks this is going to be good for understanding medicine and the future, then we're interested. And the information they get back is sort of a side benefit that right now not everyone gets, but when we're looking at their genetic code for research, we know that there's also opportunities to find things that they might not know about that they and their doctor probably should.
Can you give me an example?
Yeah, so right now we're spending most of our time focusing on risk for heart disease or cancer. Okay. So we don't diagnose the heart disease or the cancer, we find risk for it. So some people, when we find that, we go back to them and they say, oh, I already know that and my doctor and I are taking care of it. But others, it's new information. And so we've picked the 76 genes that we're giving information back because when people find out about that, there's something they can do. So they can take an action to either prevent disease or to lower the risk of getting it.
Information is power.
I think so.
A viewer emailed in and asked, what is BRCA1 and BRCA2?
BRCA1 and BRCA2, sometimes also called BRCA1 and 2, are two genes that everyone has a copy of. In a small subset of people, one of their copies of either of these genes does not work correctly. And in those specific cases, those individuals are at increased risk for certain types of cancer. So two of the big cancers we think about for women are breast cancer and ovarian cancer. There are other risks for different cancers as well, such as prostate and pancreatic cancer. So it can affect both men and women, even though it's often thought about in the context of women. It's one of the most common types of results that we do return to patients enrolled in MyCode. And it's also better known in the community, especially since Angelina Jolie made a disclosure several years ago about
That she carries
having one of these results.
Okay. And another viewer emailed in, how secure are the results for genetic testing?
So we go to great lengths to protect the genetic information as securely as we do all medical records. So your medical record in your doctor's office or at your healthcare facility has to be held in certain secure areas so that it's not open to the public. And we do the same with the genetic information. So there's rules for protecting it, and we're very vigilant about following them.
Mm-hmm. And in addition to precision medicine, pharmacogenomics, did I say that correctly?
Yes, yeah.
That's also a part of this?
That will be a part of it as well. We've just started to look at everybody's DNA information to figure out when we should be giving results that could affect how you would take a drug. So it may affect how much of a drug you should take, whether you should take the drug at all. There are several drugs that have very specific warnings that if you have certain genetic risk factors, you shouldn't take the drug at all because it could cause you to have an anaphylactic reaction or something like that. There are other drugs, blood thinners, for example, that we need to adjust the dose, or maybe need to find another one that might be more effective for you.
So, for instance, if I needed a blood thinner, you could find out whether that blood thinner, whether I would have severe side effects from that blood thinner.
Right, and the dose, for example, if it makes your blood too thin, you're more likely to bleed. But if we can start you at the right dose for the right person at the right time, then you're going to avoid those side effects.
Okay, that's amazing. That's pretty revolutionary. And like you said earlier, there's 76 genes you know about now, but there's 20,000 in total that you'd like to learn more about. So how long do you think this project will take, and do you get any funding for this?
So we talk about the 76 genes as version 1.0. We're not sure what version we'll get up to, but BRCA1 and 2 are two of the genes, so the viewer had asked about those two. What we're doing is we're trying to go with a gene list that, as I said before, is sort of the highest value right now. And as we get experience with that, and as we get more knowledge about genes, we'll expand that list. So we think in 2017 we'll expand the list probably into the 80s, and we'll continue to increase probably on a yearly or maybe even more frequent basis as we feel that genes and conditions sort of meet the criteria of possibly the patient not knowing about it and it being of a benefit to them and their providers if they do. So that's sort of the criteria. A lot of people say, well, you're not going to tell me about Alzheimer's risk, are you? And right now we don't have enough knowledge about a gene that drives Alzheimer's risk that we could really give high impact information. And there's not a whole lot that someone could do with that information. So right now we're leaving things like that off the list and going more, as I said, for things like heart disease and cancer risks that we think we can really impact.
Is this a good area to conduct this type of research project?
Yeah, it's been a very beneficial area. So
Why
part
is
of it
that?
is the trust that people have for Geisinger. I think compared to most other places, when you approach a patient to enroll in a research study, most people are going to say no. Here, most people are going to say yes.
Why do you think that is?
I think a lot of it has to do with the trust that people have for Geisinger. I think it has to do with the fact that their doctors say you should do this, and if your doctor thinks you should do it, then they feel that that's something that they can do then.
I mean, the only other place that is doing something like this is the UK, is that correct?
So there's big projects in the UK and in Iceland and in Estonia. So we sort of look around at similar scale projects, and they're based mostly in countries and the healthcare systems of those countries. There's a few other big projects. One is the United States is doing what's called a precision medicine cohort, now called All of Us, where they're going for 1 million people. So that's just getting started, and Geisinger's part of that also. There's about 10 to 15 healthcare institutions around the country, and Geisinger was selected as one of those. So that'll be a 1 million person cohort, and we'll be part of that.
Okay. Do you think this will eventually help find causes and cures for some diseases like cancer or Alzheimer's?
I think that's all of our goal. So by having the genetic information on such a large group of people, you can start to observe things that you couldn't observe if you just had a few dozen or a few hundred. So we really think that the scale of this project is going to allow us to observe things about health and wellness that other people haven't had the chance to before.
And it's really important to know your family history, is that correct?
Yeah, knowing your family history can be beneficial for anyone's healthcare to help understand what risks may be running in their family, whether or not that's accompanied by genetic testing. So in all of our patients who come back with genetic results, we do try and gather family history on them, because that can help us understand better how this result may have manifested in their relatives. For someone with the BRCA1 gene, if other family members have breast cancer, that might be explained by this. So that can be really helpful to contextualize. And in other settings, it might be helpful just to know, your grandmother had breast cancer, because that indicates that you could be at a higher risk.
Mm-hmm. As a genetic counselor, what is the benefit of someone having to deal with you? Is it once they get the results, then they come talk to you about that?
Yeah, so there are a bunch of different settings that we can see patients in. So through MyCode, I primarily see patients who have received results, so I can help them understand better what that result is and what it means for their health care and their family's health. Can also help them better cope with that information and adjust to it. Some of my colleagues and myself, we can also see patients who know they have a family history of disease, and we can work with them to do a risk assessment and help facilitate appropriate genetic testing to learn if they have a strong single gene risk factor for diseases that they may have had or have in their family.
Dr. Murray has said this before, but it is important to say that if you do have a strong family history for breast, ovarian cancer, MyCode is not the way to go. It's to see a genetic counselor, to see somebody who can help you order the right test for you.
Okay. And what is involved in this genetic testing?
So right now, the DNA sample can be obtained through a venipuncture or a blood test, or through getting cells from spit. So it's just a matter of getting your DNA, and then right now we're working with a company known as Regeneron, which is in Tarrytown, New York, and we send part of the DNA sample to them, and they actually run the code. So they have a very high-tech facility and high throughput where they're running about 1,000 Geisinger samples a week. So it's going through, yes, and it's very high throughput, very high tech, and what comes out the other side is millions of letters of code. And then we have to have specialists that look through that code and find if there's any changes that are relevant. So we have large teams behind the scenes that are working on this. We're just sort of the front end of it.
Wow. So there's still a lot more that needs to be done. Mm-hmm. Are there any other challenges that precision medicine is facing?
I think the one that's a challenge but also an opportunity is the fact that we are creating how to do this. We're the first ones to really do this on this kind of scale, and so we are writing the book on how to do this, and so that's why we were invited actually to be part of All of Us, the United States program for 1 million patients, because we have the expertise how to recruit patients and how to give back results and what to do after that as well.
Okay. And Geisinger is still looking for more patients. Can anyone sign up to be a volunteer?
So right now, to join MyCode, you have to be a Geisinger patient. So that means that you have to have, at some point in your life been at a Geisinger facility for healthcare. So some people say, do I have to have a primary care doctor there? No, actually about a third of the MyCode patients that we've seen back for results have their primary care elsewhere but have seen a Geisinger specialist. We also have people that have joined that have just been to the emergency room once or some other interaction with the facility. So, so we have a broad invite out there for anybody who wants to join.
What are some of the samples? How are the samples helping Geisinger? What are they helping Geisinger do right now? The samples that you've already collected.
So we've had a couple of cases where we've identified somebody's having increased risk for a disorder, and when we start to screen them, we find that we actually caught them really early on having a cancer. And so it's easier to treat cancers when you catch them early, and so in a couple cases we have really good evidence that the fact they found this test, or the fact they had this test, got this result, made them do something, and that something actually probably saved them from having a more advanced form of cancer. We've also seen this with coronary disease, somebody who was at high risk for having a heart attack, and she had a high cholesterol because of genetic reasons, and this prompted her to talk to her physicians about this, and ended up preventing her from having a heart attack.
Wow. That's amazing. How do you feel about being a part of such a revolutionary approach to medicine? I mean, I find it fascinating.
Yeah, I think it's really exciting because even the way more traditional genetic service models work is that somebody has to get sick before medical care is initiated in them. With projects like MyCode, many of the patients that we give results back to have never had cancer or heart disease that they may be at risk for. So we really have an opportunity to get in there and intervene before something really impacts their health in a negative way. So as Dr. Manikam mentioned, catching cancers early or preventing them from happening. Some of our conditions predispose to sudden cardiac death, so preventing those kind of tragic events that can occur in an individual or even their family members, since genetic conditions run in families, and that is really kind of special and something.
So if you know heart disease runs in your family, you can go in and have your DNA or your genes tested, and then from that you'll get information about what you're at risk for.
So right now with the program, about 1 in 30 people are expected to eventually hear back from us with this version 1.0. So 29 out of 30 won't, and we always tell people that if you don't hear from us, no news is no news. Okay. We don't kind of call people up and say your checkup is good, but we reach out to them if we find something that they need to know about. So right now it's a communication of risk results when we find them. Ultimately, we may be able to give people a more comprehensive idea about what's going on in their genetics. But right now, in these early days, we're sort of focusing on the high impact things that we have a lot of knowledge about and we know something can be done about. So it's early days, but eventually we'll be given way more.
You've already been at it for 4 years. Do you think it'll advance quickly?
Yeah, I think we're advancing rapidly already. When you think about the Human Genome Project, so the sort of the textbook that we're all using to understand this genetic code was only completed in 2001. So just in a matter of a little over 15 years, we've gone from just starting to read the textbook to these giving back results in people that had no idea they were at risk for something. And I think in 15 more years, who knows, the sky's the limit.
And if students want to study this, the Commonwealth Medical College is the place to go for that.
That's right, and we're going to try some innovative ways to get people to understand this a little better to the students, and this is an opportunity again that we can try to think about things in a very different way than medicine's traditionally been taught.
Yeah, I think for people that are watching, if they're considering careers, genetic counseling is always listed as one of the growing careers. We need lots more genetic counselors. We need people with math and science interests. So it's not just physicians or nurse practitioners or physician assistants. It's people with science interest and math interest and genetic counseling interest. So lots of jobs of the future will be in precision medicine for sure.
Good to know. Thank you. Once again, I'd like to thank our panelists for participating in our discussion on precision medicine. For more information and to continue the conversation on this fascinating topic, visit wvia.org/CTD. I'm Paula Giangiacomo for Call the Doctor. Thank you for watching.